I've been serving since November of last year, and the thing I said I wanted to get done first was to eliminate lead poisoning in children. I didn't expect at the time to get notice a couple weeks later that my then 1-year-old daughter had elevated lead. It's a pervasive thing, especially for people who live in older homes like the one I do.
We have older housing stock, most of it pre-1978, and that's the source of most of the lead exposure for children. So it's from the lead paint, as well as paint chips and dust that's from the lead paint.
Hi, we're from the Detroit Health Department, and we're actually doing lead screenings in the area, testing the paint in homes if you have kids 6 or under that live or visit.
Well, come on in.
Sure.
Every time a door opens or closes, a window opens and closes, it just has a little bit of friction. And that little bit of friction is enough to let some dust out in the air. Before you know it, your lead levels are elevated, but it's also in the soil.
A soil sample, it's going to tell you a lot about the chemical properties of your soil. So before you start forming your farming ideas and all that, you really want to know what's happening inside your land. So we recommend that a soil test happens at least once a year before you start growing or after the season. Those are typically the best times to get a soil test done. Keep Growing Detroit provides a free soil test to each of its members per year.
Our newest initiative is a partnership with Detroit Public Schools, where we are providing testing in the schools as well as education. Some of that education happens in the community through our door knocking and identifying families that are in need of these services. As part of those services, we also provide lead cleaning kits and a demonstration on how to best clean your home.
One of the things that's been increasingly important for me has been to try and share the examples that I've gotten and the lessons I've learned from Lillian having elevated lead. And when we started this, she was at 11.5. At her most recent test, she was at 4.5. The biggest thing I can do is talk about it, right? And encourage people to get tested, making sure that every resource that was presented to me and my family is available to everybody who she sees. And we need to make sure that our children are protected.